Hello, this is Dr. Wu, Dr. Physical Therapy. I'm also a former physician and a foreign medical school graduate. So today I'm going to talk to you about this, and this is drawing needles. And then the technique that physical therapists can use to help you is called drawing needling technique. So today we'll discuss what is dry needling. Okay, so it's a needle that used by the acupuncturist and other professions, and it's called dry means that there's no medication involved, and it's different compared to acupuncture and the local injection like with lidocaine or cortisone injection. So the biggest difference between acupuncture and dry needling is the acupuncturists are looking for the acupoint. An acupoint is a point that in the body that if they find a point and they put a needle in, they're looking for this physiological response, meaning they might have less pain or less dizziness or better appetite, this sort of thing. Now, for the dry needling is different. We are looking for the acupoint or connective tissue or even specific nerve and tight tissue. For example, when we put a needle in, we're looking for the trigger point. The trigger point is those tight tissue point there. So for the most common one is the upper trapezius muscles. So if you put your hand like here and then grab it, then you feel like it's a point that is very tender. And then when you push it, sometimes the discomfort might shooting down into your elbow or even to your hand, or you feel like the pain should go up to the neck or to the eye. So that's what we call the trigger point. So again, the needles will go to the trigger point, and it will actually help decrease the pain, decrease the spasm, decrease the muscle tone, and that's how we can help with it. And another thing is that the local injection by physician or nurse practitioners, like a lidocaine injection or the cortisone injection in the trigger point, it's different. Okay, they are using the medication, and for the lidocaine, it's basically numb the tissues. It doesn't help you in the long term. And for the cortisone injection, it actually will decrease the bone density, and so it's not recommended to use very often. It's recommended to do less than 6 times injection per year. I can tell you that a lot of my clients that had the injection in the past, and the benefit only lasts for a couple of weeks. Could be 3 weeks to 6 weeks, but it never lasts for long. And then the risk of the bone density drops, so you might have diagnosis with the osteopenia, osteoporosis. So personally, I don't think it was worth it. Okay, if you are doing this injection, find a physical therapist and ask them if the dry needling can help to control the symptoms without the side effect of the cortisone injection. Okay, so how does it work? When the needle go into the muscle, and when there's a pain over there, there's a trigger point over there, you might feel a temporary relief, and the muscle tone will drop. And that's how the needle can do, and it actually can restore these relationship of other muscles, like one muscle group with its others. So because all the human body, the movements, it need to coordinate it by several muscle groups. And if one muscle group cannot do the right thing because of it developed some trigger point, using the dry needles, it can decrease the trigger point irritation, and you can do better. Now from there, you still need to work on this restorative biomechanics. And that's how you can get the best outcome. And of course, the dry needling this technique can be used in different parts of the body. You can go use the neck for the headache, and then even for the scalp, and even for the face. If you have the TMJ, you can do the dry needling on this area, and then all the muscles, like the bite muscles here, like that. Or you have the Bell's palsy, and then the Bell's palsy, because of the facial muscles are not function good, and of course we can do the soft tissue mobilization, but I can also use the needles to wake up those muscles. Then you can do a little bit mobilization, and then exercise from there is going to be more efficient. Okay, now what about the risk? Yes, the risk is there because all the needles go into your body. The first thing is that infection. So you can see This needle is single packed, so it means that each one of them is singular packed and has this white thing. Let me open it so you can see it. And inside, like this. Okay. Now, let me take it out. Now here, this the plastic thing, that's the guide, and inside that's the metal thing, that's the needle. So that's the needle in the center. Get closer. There you go. Now, inside, as you can see, I put it like this. The needle doesn't drop because it has some groove on here, on only one side, and you might not be able to see it through the camera. So basically, what happened is that this groove here is gonna stop this needle from dropping. And when I'm ready to do, then it will find a guide, go to the point like this, and if I find the trigger point over here or connect tissues there, then I can put my finger here and then just tip it. Then the needle will separate from the groove and with the edge of the guide, and then let's see if you can hear that. Okay. Okay, there's a small click. Now you can move. Now I'm gonna move it out. Now that's the needle. Okay. So, so we talked about the risk. The first one is the infection. So it's a singular packet and with the singular guide. And when we use it, we we wipe the skin before and after, and we wear the glove, and so decrease the chance of the infection. And of course, we go through the muscle, so you might have a little bit bleeding or bruises risk, but it's only temporary. Okay, in about a couple of days, it'll go away. Another one is that the needle might go into the nerve, yes, but it's so small, so the irritation will be temporary, and you should go away very quick. And the last one is if this needle go closer to the chest area, then you increase the risk of pneumothorax. But it's very, very rare for acupuncture, for the acupuncturist or the physical therapist trained with dry needling to have that kind of side effect. Because we've been very careful not to go through it. That's why you need to find an experienced physical therapy with training of the dry needling. Okay. Now, what about the internal organs injury? Is also very low. It's 1 in 20,000 because the needle we can control not to go that deep. Okay. Now, and the other thing is what kind of symptoms that will be effectively treated by the dry needling. The first one is like I said, the trigger point of any muscles. For the upper trapezius muscles, we do use it very often for the upper trapezius muscle, which is the shoulder muscle over here. But sometimes it also works for the rotator cuff muscle, which is the inside this muscle, and then inside this joint, and you have a rupture of the tendon, or it's the ligament, or it's the capsule. And then use this needle, go into it and find the painful spot and then connect it with the electrostimulation. You would drop down the irritation, and therefore you can do more of your exercise. Again, you gotta restore this biomechanic relationship of the body. And then dry needling is not magic, but it definitely can help you to decrease the irritation so you can recover faster and control the symptoms. Yeah. So my patients sometimes just Friday want to get in. If they can come with me, they can see my assistant. But I always ask that can we spend about 10 minutes just do this dry needling with the electrostimulation, and then after that they report that they can have a better weekend. Okay, now what are the other things to expect? Okay, so you might feel a little bit drowsiness, a little bit dizziness, and that's very, very common. And so if you know that if you know that you are not going to be good with the needles, then you probably can ask your friends or family members to go with you to your appointment so they can drive you home. And again, the side effect is very, very low. So the serious side effect is only 0.01%. So it's very, very low. Anyway, so what about experience? My experience with the joint healing is that I have very good outcome with the numbness in the hand. So if you have the numbness in your hand, find me, and I can most likely to take the numbness away in only one visit. Yes, you hear right, only one visit, and that's how powerful it is. Before I use the joint healing to help my client, I need to spend more time. I do the manipulation on the neck, do the stretching on all the muscles, and including the shoulders. And right now, I can pinpoint on the muscle. I can go very directly to the muscle that is causing a problem, and then I can take away of the numbness in only one visit. Okay. And then it also helped with the headache, but again, the headache has so many things contribute to that. You might heard about the like a migration, or like a migraine, or is the mechanical related headache, and that's what we can do. Or you might notice that a lot of the muscle is tight, and then I will go specific to that muscle, and then to relax the muscles, with the needles, and then we can do exercise from there to get the best outcome. Okay. Now, if you happen to live in Albuquerque, New Mexico area, you can definitely find me, and I'm more than welcome to. I'm more than happy to help you, and I'm very good with the numbness. My outcome is very good, and just one visit I can fix it, and with the numbness and tingling. And not everyone feel comfortable with this, because we do need to go into this. There's a triangle here for us to see this front part of the scaling, and we also go to the side of the middle bundle of the scaling. So we're gonna put up more. I will put up more educational videos in future about this. And if you're interested, remember to subscribe to my channel. And or you have any questions, just ask me. And anyway, that's what today's topic about the joint healing, and hopefully you learn something from it. Until next time, thank you. Bye.